Welcome, health-seeking peers, to another amazing health topic. Today we delve into the world of artery health and how healthy arteries and careful maintenance of the vital organ will add years to your life and put an end to costly medical bills. But before we begin, don't forget to like and subscribe. Arteries are vital components of the cardiovascular system, serving as the highways that transport oxygen-rich blood from the heart to various tissues and organs throughout the body. These blood vessels are cylindrical in shape and are composed of three layers: the intima, media, and adventitia. The intima is the innermost layer of the artery, consisting of endothelial cells that provide a smooth surface for blood flow. This layer also plays a role in regulating the dilation and constriction of the artery, which helps to control blood pressure. The media is the middle layer of the artery, composed of smooth muscle cells and elastic fibers. This layer is responsible for the elasticity and contractility of the artery, allowing it to expand and contract in response to changes in blood flow and pressure. The adventitia is the outermost layer of the artery, composed of connective tissue that provides structural support and protection to the vessel. It also contains nerves and small blood vessels that supply oxygen and nutrients to the arterial wall. Arteries play a critical role in maintaining proper blood circulation throughout the body. They carry oxygen-rich blood away from the heart to deliver it to tissues and organs, ensuring that they receive the nutrients and oxygen they need to function properly. Additionally, arteries also help regulate blood pressure by adjusting their diameter in response to changes in blood flow and demand. The health of arteries is essential for overall cardiovascular health. When arteries become damaged or diseased, it can lead to various health problems, including atherosclerosis, aneurysms, and hypertension. Atherosclerosis, in particular, is a condition characterized by the buildup of plaque, a combination of cholesterol, fat, calcium, and other substances within the arterial walls, narrowing the vessel and restricting blood flow. This can increase the risk of heart attack, stroke, and other cardiovascular complications. Maintaining healthy arteries is crucial for overall health and well-being. Lifestyle factors such as regular exercise, a balanced diet, avoiding smoking, and managing stress can help promote artery health and reduce the risk of developing arterial diseases. Additionally, regular checkups with a healthcare provider can help monitor and manage risk factors such as high cholesterol, high blood pressure, and diabetes, further supporting artery health and reducing the likelihood of cardiovascular complications. Adopting a healthy diet is crucial. Focus on consuming plenty of fruits, vegetables, whole grains, and lean proteins. Reduce your intake of saturated and trans fats, which can contribute to the buildup of plaque in your arteries. Regular exercise is another key component of artery health. Aim for at least 30 minutes of moderate aerobic activity most days of the week. Exercise helps to improve blood flow, lower blood pressure, and reduce cholesterol levels, all of which are beneficial for clearing out arteries. Quitting smoking is essential for artery health. Smoking damages the lining of the arteries, making it easier for plaque to accumulate. By quitting smoking, you can significantly reduce your risk of developing arterial blockages. Managing stress is also important for artery health. Chronic stress can contribute to high blood pressure and inflammation, both of which are risk factors for arterial plaque buildup. Practice stress-reducing techniques such as meditation, deep breathing exercises, or yoga to keep your stress levels in check. Maintaining a healthy weight is crucial for artery health. Being overweight or obese can increase your risk of developing conditions such as high cholesterol, high blood pressure, and type 2 diabetes, all of which can contribute to arterial plaque buildup. Focus on eating a balanced diet and exercising regularly to achieve and maintain a healthy weight. It's essential to regularly monitor your cholesterol levels, blood pressure, and blood sugar levels. High levels of cholesterol, blood pressure, and blood sugar can all contribute to arterial plaque buildup and increase your risk of developing cardiovascular disease. By keeping these levels in check through regular checkups with your healthcare provider, you can help prevent the buildup of plaque in your arteries and maintain overall artery health. Clearing out clogged arteries, also known as arterial decluttering, can have numerous benefits for your health. Improved blood flow. Unclogging arteries allows for smoother blood flow throughout the body. When arteries are narrowed or blocked by plaque buildup, It can restrict blood flow to vital organs and tissues, leading to various health problems. By removing blockages, blood can flow more freely, delivering oxygen and nutrients to cells and organs more efficiently. Reduced risk of cardiovascular disease. Clogged arteries are a major risk factor for cardiovascular diseases, such as heart attack and stroke. Atherosclerosis, the buildup of plaque in the arteries, can lead to the formation of blood clots that can block blood flow to the heart or brain. By clearing out blockages, the risk of these life-threatening conditions is significantly reduced, promoting overall cardiovascular health. Lower blood pressure. Arterial decluttering can help lower blood pressure by improving blood flow and reducing the resistance to blood flow caused by narrowed arteries. High blood pressure or hypertension is a common condition that can strain the heart and blood vessels, increasing the risk of heart disease, stroke, and other health problems. By restoring normal blood flow, arterial decluttering can help lower blood pressure and reduce the risk of associated complications. Improved organ function. Adequate blood flow is essential for the proper function of organs throughout the body. When arteries are clogged, organs may not receive enough oxygen and nutrients, leading to decreased function and potential damage. Unclogging arteries can help restore proper blood flow to organs, improving their function and overall health. Increased energy levels. Improved blood flow resulting from arterial decluttering can lead to increased energy levels and overall vitality. When organs receive an adequate supply of oxygen and nutrients, they can function more efficiently, leading to increased energy production and a greater sense of well-being. Enhanced quality of life. Clearing out clogged arteries can improve overall quality of life by reducing symptoms associated with poor circulation, such as chest pain, angina, shortness of breath, and fatigue. By restoring proper blood flow, arterial decluttering can help individuals engage in daily activities more comfortably and enjoy a higher level of physical and mental well-being. Unclogging arteries reduces the risk of cardiovascular disease, improving organ function, increasing energy levels, and enhancing overall quality of life. It's essential to adopt a healthy lifestyle, including regular exercise, a balanced diet, and smoking cessation, to support arterial health and prevent the recurrence of blockages. Artery awareness is crucial for understanding the importance of these blood vessels in maintaining overall health and well-being. Arteries play a vital role in the cardiovascular system, serving as the conduits through which oxygen-rich blood is transported from the heart to various tissues and organs throughout the body. One key aspect of artery awareness is understanding the risk factors that can contribute to arterial disease and dysfunction. These risk factors include high blood pressure, high cholesterol levels, smoking, diabetes, obesity, sedentary lifestyle, and a family history of cardiovascular disease. By being aware of these risk factors, individuals can take proactive steps to mitigate their impact and promote artery health. Another important aspect of artery awareness is recognizing the signs and symptoms of arterial disease. Common symptoms may include chest pain or discomfort, angina, shortness of breath, fatigue, weakness, numbness, or tingling in the extremities, and difficulty walking or climbing stairs. These symptoms can indicate various arterial conditions, such as atherosclerosis, peripheral artery disease, or coronary artery disease, and should prompt further evaluation by a healthcare professional. Artery awareness also involves understanding the importance of preventive measures to maintain artery health. Adopting a healthy lifestyle that includes regular exercise, a balanced diet, maintaining a healthy weight, managing stress, and avoiding tobacco use can help reduce the risk of arterial disease and promote overall cardiovascular health. Additionally, routine health screenings, such as blood pressure checks, cholesterol tests, and blood glucose monitoring, can help identify early signs of arterial dysfunction and allow for timely intervention. Artery awareness encompasses knowledge about available treatment options for arterial disease. Depending on the severity and location of arterial blockages, treatment may include lifestyle modifications, medication therapy, minimally invasive procedures, such as angioplasty and stenting, or surgical interventions, such as bypass surgery. Being aware of these treatment options allows individuals to work with their healthcare providers to develop personalized treatment plans that best meet their needs and preferences. Overall, artery awareness is essential for promoting cardiovascular health and reducing the burden of arterial disease. By understanding the role of arteries in the body, recognizing risk factors and symptoms of arterial dysfunction, and implementing preventive measures and appropriate treatments, individuals can take control of their artery health and reduce their risk of cardiovascular complications. Regular communication with healthcare providers and ongoing education about artery health are key components of maintaining artery awareness throughout life.